You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Happy holidays to all of our listeners out there, and thank you for joining the Mother to Baby podcast. My name is Chris Stallman, and in case you don't remember or you're new to us, I am a genetic counselor. I'm a mom of 3, almost 4, about to deliver within the next couple of weeks, and I am a teratogen information specialist. And so what that means is that I give information to patients and healthcare providers about exposures during pregnancy and breastfeeding. And an exposure can be anything. It could be a food that you heard you shouldn't eat while you're pregnant or breastfeeding. It could be eggnog or other alcoholic drinks that come up during holiday time, or it could be over-the-counter medications. Can I take Tylenol because I have a headache? We answer all of those questions and more at Mother to Baby. We are a non-profit service, and so that means all of our services are free to you. And we have people who call us, people who chat with us over our chat feature that can be found on our website. Also people who text us, and then people who visit our website as well for our fact sheets. Our website is MotherToBaby.org, and if you go there, again, free to you, you can find out all of the information that I just spoke about, plus a whole lot more, including studies that we do, research that we've done, and a whole lot of interesting things. Today's episode is part 2 of the topic of diabetes. So in the last episode, in case you didn't hear, what we had was a chat between myself and Mother to Baby Utah expert Alfred Romeo. And we talked a lot about gestational diabetes because as a woman who is in the 3rd trimester of pregnancy, I have been diagnosed with diabetes and I have lots of questions. And as a provider, I answer these questions all the time to women on the phone or over chat. So just a reminder, Alfred Romeo is a registered nurse. He has a doctorate in health promotion and education. He works for Mother to Baby Utah. He's on some of our organizational committees and does an incredible job with his leadership roles. And his experience includes working as a nurse in a newborn intensive care unit, or NICU for short. And that's something we talked about a lot the last time because as a nurse and someone who has worked in that environment, Alfred has seen a lot of babies that had come through after mom had diabetes in pregnancy. So his expertise is especially welcome here. Alfred, thanks so much for joining us again today.
Thank you for having me out. And yes, it's difficult to see some of these babies struggle through some of the complications and difficult to see the family dealing with the baby in that environment. So yes, we're hoping to help moms learn about diabetes, how to prevent it, how to deal with it, so that we reduce those risks. Remember that there's always that background risk of 3 to 5% chance of having a baby with a birth defect, but uncontrolled diabetes increases that risk from about 5% to about 20%. So we're going to talk a little bit today about some of those things that mom can do to control it before pregnancy, during pregnancy, and after pregnancy.
And that's excellent. That's exactly what we talked about last time. So we went over, the chance that there is a risk for birth defects, but diabetes is one of those things where we can reduce the risk. And also as a reminder that January is actually birth defects prevention month. And, like you said, there's a 3 to 5% background and that can happen no matter what. But when there are ones that are preventable, I find that women like to have that information so they can make any kind of changes that they need to make as well.
Absolutely. And last time, Chris you talked a little bit about some of the different tests that you're going to get during pregnancy. One of the things that we want to encourage women to do on a regular basis throughout their reproductive years is get those regular annual checkups to include the glucose test. So the doctor may have you fast for a while, usually overnight, 8 hours, and they're going to check your blood sugar. They may take a finger prick or draw blood and see what your blood sugar is. And that's important to help you see if you have diabetes before you become pregnant and get good control of that before the pregnancy.
And I think that for me, it was especially helpful because when I got pregnant and my pregnancy was planned. We also know that there are lots of pregnancies out there that are unplanned, but they did want to have that information before, just in case that, I had diabetes outside of pregnancy. Like you said, they wanted to make sure that I was in a good place and as healthy as I could possibly be before I tried to get pregnant. The thing is, if you don't know that you're going to be pregnant because it's not a planned pregnancy, it's a little bit trickier. And that's why, like you said, it's a good idea to make sure that you keep up with your health, whether or not you're actively trying to get pregnant, just because sometimes things happen and some things should be taken care of sooner before later.
Right. So just as you're taking your folic acid throughout your reproductive years to help the development of the spine early in pregnancy, we want to make sure that you're doing some of those other things, making sure that you're trying to reach that healthy weight throughout your reproductive years, eating a balanced diet. We want you to make sure that you're getting a variety of different foods, all of those nutrients and things like that to supplement those prenatal vitamins, getting regular exercise that you will hopefully continue throughout the pregnancy, depending on the type of exercise and your condition. But yes, trying to be as healthy as possible before the pregnancy and then throughout the pregnancy to help reduce the chance of having uncontrolled diabetes. And then if you do have diabetes, some of those same strategies are going to be, again, making sure that you're getting the exercise to control the diabetes, getting the good nutrition. So some of those things follow before and during the pregnancy.
Okay, and so that leads into specifically what I was going to ask is, what can I do to have the healthiest pregnancy possible? So it sounds like eating a balanced diet, and I think that may include seeing a dietitian in order to help you get that into place in case you need to, because some people have really strict diets, and some people follow different lifestyle diet plans, and then other people just sort of eat what's there. And I know that can be a complicated piece. So if a woman does have diabetes of any kind, so type 1, type 2, or gestational, is it a good idea to meet with a dietitian?
Yes, it's a good idea to meet with a dietitian to make sure that you're looking at those different foods and which types of foods, how much types of those foods, so that you're getting that balanced diet and not getting too much of those foods that could put you at greater risk for diabetes, or that if you already have diabetes type 1 or type 2, could cause swings in blood sugar. So there are different things and different strategies that the nutritionist can help you with to try to meet those. We'll talk about medications, but yes, the nutritionist definitely can help you come up with some of those good strategies so that you're picking the right foods at the right time and the right amounts.
That's a good point too, because now that I'm getting closer to delivery, I have to admit I find it harder to eat because I'm basically filled up with baby at this point, and there's only one in there unless one's been hiding. Just know that if that's your case, if you're not feeling hungry or you're having trouble keeping food down, we hear about that quite a bit. Make sure you let your healthcare provider know, so that way they can get you to a dietitian who can help you come up with other options.
Absolutely, yes. It's a fine balance between gaining the weight that you need to appropriately to support the baby and not having too much weight that puts you at greater risk for, say, gestational diabetes if you don't have type 1 or 2 before you have pregnancy.
And how about exercise? So I know that, again, that's going to be different for every woman. And we always say, talk to your healthcare provider before starting an exercise plan that they haven't previously approved or something that's new to you. And there's probably going to be some activities, especially those that have an increased risk for fall or to hurt yourself, that they're going to want you to minimize. So probably no kickboxing would be my guess throughout pregnancy. But there are a lot of options for exercise. And so, Alfred, for exercise, is that something too that for most women is going to be recommended to help with diabetes?
Correct. For most women, we want them to again, throughout their reproductive years, have a good physical activity, not necessarily think of it as exercise. I got to go to the gym and work out. But a physical activity so that you're moving, you're active, you're doing some of those aerobic things throughout your reproductive years. And yes, during the pregnancy, leading up to the pregnancy, if you have a good walking program, if you have a jogging program, program. Yes, try to keep doing those things throughout the pregnancy to maintain that activity level. Of course, as Chris mentioned, avoid those different impact ones like kickboxing, and some of those things that are a little bit more jarring. Definitely talk to your provider about your exercise plan. You may have other medical conditions that would limit the different types you can do, but generally we want you to stay active throughout the pregnancy.
And I think you made a good point too about not necessarily calling it exercise. I don't think of exercise as a bad word, and I wish you could see I'm doing those silly finger quotes. I don't think about it as a bad thing, but it does make a difference if you say to me, I need you to exercise today versus saying, hey, I really need you to take your toddler swimming. It's like, oh, those are two different things. One of them is a fun thing I get to do, and the other thing is something I have to do or else someone's not going to be happy with me. So I think that's a much better way to put it. We want you to stay active versus, you have to exercise.
Right, and we want you to get, for example, those 30-minute activity blocks a few times a week. That can be going out and doing yard work. That can be walking. You're going out in the neighborhood, you're visiting neighbors. So there's a variety of different things. Yes, swimming with the kids in the pool. There's a variety of different things that you can do that are just kind of healthy lifestyle things, taking the dog for a walk. So don't think about it, as I mentioned, going to the gym and doing weights and having to run on a treadmill at a high rate of speed. It's all of those things to keep us active and moving. If I work in an office, I need to get out of my chair and maybe climb a couple of flights of steps on my break. So there's a variety of different things you can do to help you and to help baby.
Well, that's great because during this pregnancy especially, the only running that I'm doing anywhere is to the ladies' room. So I'm glad I don't have to think about going to run on a treadmill if that's not comfortable for me. So thank you.
Absolutely.
I'll walk, I promise, and walk quite quickly. But yes, probably not that. So, and again, if you are exercising, even if it's something that your healthcare provider cleared and said absolutely, if you're feeling uncomfortable, if you're having pains, because of course, your body gets bigger and changes during pregnancy. If you're uncomfortable at any time, absolutely stop. And if you're having any symptoms that seem really unusual, certainly if you're bleeding or anything like that, make sure you talk to your healthcare provider right away. But I will say too that in my experience with the research that most women do well when they stay active throughout their pregnancies.
And also after the pregnancy, we don't want you to lose the weight too fast. You need some of those stores to help you produce breast milk and to help you recover from the pregnancy, whether it's a vaginal delivery or C-section. So don't try to do it all at once or try to do it too quickly. Work with your provider, yes, again, so that you make sure that you're doing it at the correct pace for you and your body.
Okay, so let's switch gears a little bit and let's talk medication, because on a daily basis, that's what you and I both do, spend a lot of our days talking about different medications or exposures in pregnancy. And I get it quite frequently. So diet and exercise is absolutely beneficial to a lot of women in a lot of ways, but sometimes it's not the whole picture. And actually for this pregnancy, that was the case for me as well. They've tried me on a couple of different things and they've worked in different ways. And, it's easy when it's me because I know the risks of medications or if it's not a risk, but just in general. Are there any medications that a woman could take to treat gestational diabetes that would be harmful to her pregnancy?
So generally those medications that you're going to be prescribed for gestational diabetes can be taken during pregnancy. One of the most common ones is insulin. Insulin, we do not see any increased risk of problems, birth defects, or other issues above that baseline risk that everybody starts with. So insulin is a very common one to be used later in pregnancy for gestational diabetes. Remember, if you have type 1 or type 2 diabetes and that you already have those medications, if you do find that you have become pregnant, continue on those medications until you get to see your provider. Don't go off of them without having a plan with your provider. But insulin is that most common one that the providers will prescribe for mom.
I think that's a good point to mention, especially with the medication that treats an ongoing health condition like diabetes. So if you had diabetes before, definitely we don't want you to stop taking your medication until you talk to your provider, because that could be harmful for you too. And we definitely don't want to go down that road. What they did for me first was they tried me on a medication called metformin. And that also based on the research, because I'm sure you can guess, I absolutely looked this up and down before I decided to take it in pregnancy. But that too has not been shown to increase the risk of birth defects over the background risk. And it hasn't been shown to increase any complications in pregnancy. In fact, for some women, it works really well and it helps their body control their blood sugar a little bit better. So for some women, that type of medication, so instead of insulin, there may be something different like metformin or other medications that they prescribe that, again, usually are going to be compatible in pregnancy.
Right, and it depends on how severe your diabetes is to what medications they might consider. If you have type 1 diabetes, you're likely going to be on insulin. If you have gestational diabetes, yes, you may be on metformin and be able to control it with a combination of metformin and exercise and nutrition. So it's really going to be tailored to that particular woman.
And that's the thing too. We tried a couple of different things and, that's what you sort of have to see. And I know in pregnancy, we don't really like to do trial and error, but if it's a condition that's new to you because of pregnancy, so like it was for me, I didn't have diabetes before pregnancy, so I wasn't on insulin or any other medication. And so now we're here and I have to be treated, but we still need to sometimes make adjustments or change medications, again, which isn't ideal, but if it's not working, what they want to do is get me to a healthy place as soon as possible and hopefully maximize the chance that the baby will be at a healthy place as well.
Absolutely. So it's very individualized. Definitely get in to see your provider. If you have a history of gestational diabetes, you definitely want to give your provider a call for that first appointment. Let them know that you have that history. And they can usually get you in before some of those healthy patients get to see the provider later in their pregnancy.
Yes, and with my experience too, at least they were able to talk to me. So they wanted to see me at a certain time of pregnancy, because there are some other things that can go on during pregnancy, but they at least wanted to have that conversation in the beginning about what kind of testing I needed to have and what they were going to look for. So if you think that you are pregnant, if you're trying to become pregnant, and if you have any concerns about your risk for diabetes for any reason, it's always a good idea to bring it up with your provider. Even if you're not planning right now, it may be a good idea to have the conversation so at least you're prepared.
Absolutely.
Okay. So Al, we're nearly done here, but if you could, I wanted to know if you had a final thought or message for our listeners about everything that we've talked about over the last 2 sessions.
So one of the important things to remember about diabetes and all of your different conditions is make sure that you're as healthy as possible throughout your reproductive years. Folic acid, prenatal vitamins, all of those things, exercise, nutrition, they help provide the best environment for baby before you get pregnant. And then if you have any existing conditions, if you have a history of other conditions, check with your provider and work with them to develop a plan to get you through that pregnancy in the healthiest possible way to help mom have a healthy pregnancy and baby have a great start.
Excellent. Alfred, thank you so much for being back with us. And I wanted to wish you and everybody at MotherToBaby Utah the happiest of holidays.
Happy holidays, everyone.
Thank you. And to our listeners, also happy holidays as well. Thank you again for joining us for this MotherToBaby podcast. I'm Chris Stallman, and that's going to do it for us for 2019. So long 2019. However, we are going to be back in 2020, right in January for the start of Birth Defects Prevention Month. And we have some excellent guests from the Centers for Disease Control and Prevention for that. So you'll definitely want to tune in, which you can do on iTunes, Spotify, or wherever you listen to your podcasts. And don't forget to subscribe. That way you don't miss an episode. In the meantime, if you or anyone you know has questions for us at MotherToBaby, as always, there's a whole bunch of different ways that you can reach us. So, of course, you can always email us questions about the podcast, or if you have an idea or want to be on the podcast, you can reach us at contactus@mothertobaby.org. So please send us an email. You can also reach us by phone toll free at 866-626-6847. You can also reach us by text 855-999-3525. And our website, MotherToBaby.org, has all of the different ways that you can contact us, including our chat feature. It has a lot of information about exposures, so things that can come up in pregnancy or breastfeeding, along with all of our fact sheets and a lot of other really good information. Again, free to you. So, this is Chris Stallman signing off for 2019. Thank you to our listeners and our supporters. We very much appreciate having you. We hope we'll have you again in 2020. And remember, Mother to Baby's here for you. Take care.
Mother to Baby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about Mother to Baby, please visit mothertobaby.org.